start the recording. Okay, so welcome everybody to Israeli HealthTech and Life Science Delegation Info webinar. My name is Sami Jääskeläinen. I'm based here in Tel Aviv. I work for the Finnish Embassy. I'm the Counsellor for Trade and Investment, and I'm going to be your host today. So it is my great pleasure to warmly welcome you our session today. And before we kick off, let's have a quick look at our agenda. It's fairly straightforward. So we have a quick welcome words from my and then Aloni's side. And then we're going to talk about then the upcoming HealthTech and Life Science Delegation agenda, which will take place on next week. So we will go through on more details what to expect, who you might meet during the week, and how does the overall program looks like. After that, we are very, very honored to have Hanna Lankinen from Business Finland Invest In team with us today. She will basically give you a little bit more information and data and all the great reasons why you should come and visit the Finland and start doing business there. And then, like mentioned, we do have the Q&A session at the end. But before I hand over the stage to Lee to do the introductions as well, just a little bit background information for all the participants, like why we are doing this delegation this summer. So we have had a lot of international collaboration now between Finland and Israel, focusing on health sector in general. We have had sessions about the digital health and the secondary use of data earlier this spring. We also had a delegation visiting from Finland, Tel Aviv, 2-3 weeks ago. And this delegation was mainly people from different health districts from Finland and representing different hospitals who can provide test and pilot opportunities for Israeli companies. And on the back of that, we actually reached a very important milestone. So we also signed an MOU between Business Finland and Israeli Innovation Authority, IIA, which is basically a supporting framework to connect Finland and Israel among focusing on life science, and these projects that we are doing now are kind of like the first big activation part. And like I mentioned, the delegation who was visiting in Israel a couple of weeks ago were the different representatives from 3 hospital districts from Finland, talk about what kind of pilot and validation and testbed opportunities they might be able to provide for the Israeli companies. And now this delegation that is going then to the other direction to Helsinki in conjunction of HIMSS 22 Europe, we want to make sure that then the Israeli companies will actually meet all the 5 major hospital districts from Finland. So Helsinki, Oulu, Tampere, Kuopio, and Turku. And then they can continue this dialogue in terms to explore these different validation, pilot and testbed opportunities. So that's kind of like the backbone and the reason why we're also here today. But before we go then to the actual delegation agenda, I'm going to hand over the stage to Aloni from Europe-Israel Economic and Innovation Forum to also say a couple of words to kick off. Lee, over to you. Okay, seems like Lee had some issues with the connection. So let's hope that she's able to join us soon. Oh, Lee, are you there? Can you hear us? Okay, seems that there are still some issues. So, okay, so without any further ado, let's then jump to the actual the program for the next week. And before I go to that, I want to give you a sneak peek about Finland and mainly actually also the Helsinki area. And because I stole this slide from Miska Hakala, who is the director of Helsinki Partners, from his presentation while they were in Israel, because I think that this summarizes many very important things quite nicely. So first of all, Finland is the 7th most innovative country in the world. We are also the happiest country in the world. This is the 5th consecutive year in a row. So obviously that's a great factor in terms of when you are looking collaboration and to understand the mindset of the Finnish people. Finland is also #1 in the most stable country in the world, and especially these times when there is a lot of economic and microeconomic turbulence, it's very, very important factor from the business point of view. Then Finland is, we're also #1 in Europe's digital economy and society. We are also #1 in personal health index in EU. And then I go back to the middle of this slide, which is the #3 on the world's healthiest countries. And this is also one reason why we want to take the Israeli innovation and great companies to visit Finland and basically to meet different hospital representatives and healthcare ecosystem stakeholders to collaborate and make also Finland even more healthier country in the world, and of course Israel at the same time. But with that, I'm going to take you then basically to our next week's agenda. So we have planned and prepared very nice program for all the participants. And for those ones who might not know, there is actually Finnair is having a direct flight from Tel Aviv to Helsinki. And one option is if you want to spend the weekend before the HIMSS to Helsinki, one option is take the flight on Friday evening. And then that will land 4:30 on Saturday morning, but it gives you, like I said, a little bit more time to enjoy Helsinki before the actual business and work starts. Another option is basically take the flight on Monday evening from Tel Aviv, and then that flight will land to Helsinki 4:30 on Tuesday morning. So, and with that, because we know that it's a quite early or late arrival to Helsinki, so we have prepared basically a half-a-day program for you on Tuesday. And this would basically start around 1 o'clock in the afternoon, when we would like to take you to the Metropolia University of Applied Sciences. It's a brand new facility very close to Helsinki Center, and they have a beautiful basically test bed and pilot and validation facilities, and we will have a guided tour for the Israelis there, which will take roughly about 2 hours to really kind of like see that what kind of opportunities they provide, what kind of solutions they're looking for, and what you could do basically with Metropolia. After that, on Tuesday, then there is actually HIMSS, the official opening at Messukeskus, the exhibition center. So we're going to take you there, and then in the evening we have a great pleasure to also to meet the Israeli ambassador to Finland and Estonia in the evening, and she also wants to greet and meet the Israel delegation before the HIMSS week actually starts. And then on Wednesday and Thursday are basically very full days with the program. So first we will start on Wednesday 10:30 with the various meetings at Messukeskus. And even though that the HIMSS actually starts at 9 o'clock, but the Messukeskus, the exhibition center, exhibition area only opens at 10:30, and hence that's kind of like the kickoff time for us as well. So first we're gonna take you to the meetings with the Health Capital Helsinki. You're gonna meet Business Finland, Invest In team also there. The broader team, Hanna will be with us today, but the broader team, and also they will help you to understand what kind of solutions Helsinki and Finland can offer, and why should be what would be the good reasons to basically visit and invest in Finland. You're also going to meet Enter Espoo representatives, and then we're going to take your guided tour for him. So this will take roughly about 2 hours of time in the morning, so 10:30 to 12:30. And after that, we're gonna let you go for a while. We know that most of you probably want to have your own meetings and meeting with the various stakeholders. and catch up with the emails and whatnot. So we're gonna let you go, but then again, we would like to gather everybody at 4 o'clock in the afternoon, and this time in the Helsinki City Center, where we would have the Helsinki Health Tech and Data Networking event at the Helsinki Partners Office. And we have gathered a very, very interesting lineup of different organizations and speakers to meet you guys then. So first of all, regarding the data and the secondary use of data in healthcare, we will have first of all FinData, we have a FinGenius and Finnish Biobanks directors and representatives. So, and for those who don't know, Finland has very innovative, I would say, legislation in terms of the healthcare data and the secondary use of healthcare data. Currently, FinData is the organization in Finland that is on a national level managing and providing access to the healthcare and social data. We do have a big pool of also biobanks across the Finland, but then FinGenius and Finnish Biobanks are the organizations who are basically organizing most of the biobanks and genomic data in Finland. So again, it's a very important, or these are very important stakeholders to meet to really understand what you can do with the data in Finland and how to get access to that and what are the processes and procedures. And maybe this is also a good opportunity to tell that currently behind FinData, there is a social and healthcare data, and biobanks and genomics are managed by different organizations, but there will be a legislation bill on the table at the Finnish Parliament after the summer, and if everything goes as planned, basically all these different data will be gathered behind one operator, which would be then the FinData in the future. So this would make then again your access and when you're dealing with the various types of Finnish data even more easier, because then all the data is sitting behind one service desk. Then we also wanna take the Helsinki University Hospital HUS team in front of you and tell what kind of projects they are doing, what kind of innovations they're looking for. HUS is the largest hospital district basically in Finland. And they are very heavily, of course, involved everything what Helsinki Health Capital, City of Helsinki, but also then what the different data stakeholders are doing. And also then there is this Clever Health Network, which is also mainly located in the Helsinki area. So their representatives and project directors are also coming to meet you to understand that, like, what kind of opportunities there might be for the Israeli companies in their various projects. And so that's going to be very, very interesting health tech and data focused networking event on Wednesday evening. And then on Thursday, we're going to kickstart the day at 10 o'clock again at the Messukeskus, where the HIMSS event is. And then basically I would say that one of the main themes of this Thursday, the second day, is that on Wednesday we are more focusing on the capital region of Finland. But then on Thursday we will cover the rest of the main hospital districts in Finland. So you would be meeting then the representatives from Oulu Health, from Tampere Health, from Turku Health, Kuopio Health, to make sure that we have covered all the 5 key hospital districts from Finland and their representatives. And then also we have a very interesting meeting lineup with the VTT, which is the Finnish government owned and one of the Europe's leading research institutes. And their healthcare team wanted to also meet the Israel delegation, so we have also meeting time for that. So after 12:30, again, going to let you go to enjoy the lunch and have your own meetings, catch up with your emails, and then later in the afternoon around 2 o'clock, we're going to take you again to the Helsinki City Center. Most likely we're going to be again at the Helsinki Partners office, and then we're going to have a pitching event for you. So then we're going to switch the tables and basically give the stage to you, and you are able then to meet other healthcare ecosystem representatives from Finland and mainly investors. And we know that many Israeli companies have been fundraising, especially last year, a lot of money. So we understand that maybe the fundraising is not the key element for this pitching event, but of course, it's important to meet the investors, to find out any kind of collaboration avenues with their portfolio companies. So this is more kind of like the angle. And then that event we're gonna wrap up probably around 7 o'clock. Then again, there's a little bit on time. Perhaps it's a good avenue to go and change your clothes at the hotel, because then we're gonna have the beautiful networking dinner at the restaurant Saaristo. It's located in one of the small islands just next to Helsinki. So we're gonna take a small boat and go and have our networking dinner. And then Friday, we know that most of you might be considering taking the flight back to Tel Aviv. There's a Finnair flight in the evening, but so we're only going to take a couple of hours your time on Friday morning, and we are having a session where we have, I would say, the leading experts and consultants from Finland who have been involved for the various Horizon Europe projects, to talk about then that what kind of collaboration opportunities there might be with the various Finnish stakeholders or the companies, what kind of joint projects that might be looking for, and what are the different funding models, for example, for this project in Horizon Europe. And then it's a wrap. Then it's a wrap basically, and we also wanted to save a little bit time if you wanna explore beautiful Helsinki before taking the flight back to Tel Aviv. And now I can see that Lee is back online, so maybe we will take your greetings and welcome words to this at this point.
I'm sorry, was there some internet connection issues in here? I have no idea why. So greetings to all anyway. Thank you very much, Sami, for the long brief about what we are planning to do in here. It's a second webinar that we are taking already. We have 2 or 3 more spots actually on the delegation, so it's really important to say it. I do believe that Sami actually screened all the 3.5 full days that we are exploring in here. Something that is very important from my perspective to emphasize is that the Israel Innovation Authority signed the contract not long time ago, and they are supposed to publish their call for proposals, I assume, in the next few weeks. Having said that, all Israeli companies need to go back and forth to Finland in order to scout for Finnish partners, in order to submit their application for the call for proposals in order to be entitled to get the funds from the IIA. Meaning that I do suggest that if we already did quite a lot of work only for your sake, make sure that you will be on board, because otherwise it will be almost mission impossible for you to reach out to so many organizations at the same place at the same time in order to extend your possibilities to reach out for an MOU based on whatever is needed according to the IIA. So, of course, it's our recommendation. We don't charge anything for this participation in this delegation, as it's been sponsored by the governments. Therefore, please join in, because the next one that we will take, it will be only Finnish companies, and VCs will come to Tel Aviv on September. Then it might be that you are actually missing the slot until the end of September, maybe October, to submit your application. Then you will have to do everything by yourself. So we only suggest, we can only recommend. I recommend also to share the information. Of course, we will be here to support you, even if it will be individually, but then it will take much more work and efforts and of course funds from your company in order to meet most of the people, as Finland is a very big country. So to go from one place to another, going up north will take you 5 to 6 hours instead of meeting them in Helsinki when they're coming to HIMSS. So it's only like a personal note on that aspect. We are here for you. So we still have 1 week to go. If you're not sure if you would like to come, what are your benefits? I'm here, Sami is here. Just use us on that note, and then we will help you out to try to understand if you have possibilities in here, what are the possibilities, and try to reach out to the market much better than only staying in Israel, trying to understand if it's that. I like Finns, Israelis, building a trust of a long partnership. So I do suggest that please come over, beside the fact that the weather is amazing. The situation is that it's the best possible, or I would say the best program we could feature for you to get the best exposure for Israeli companies to get deep dive in for the ecosystem in Finland. So try just to use it, and we are here for you. Don't hesitate to contact us. That's it.
Yes, thank you, Lee. And like I said, Hanna Lankinen from Investin team will then tell soon what kind of support the Business Finland can provide once you reach that point. First of all, if you want to open a legal entity in Finland, but also we understand that in this journey, when you are exploring the collaboration opportunities with the Finnish validation or testbed or pilot providers, you need to understand the local regulatory environment. What does it mean from the EU perspective? Because also Finland is a good gateway for the Nordic and EU markets. And Business Finland Invest team can support you and assist you to navigate this application phase. And of course, then in later on, if you will open a legal entity in Finland, then you would be entitled for all the possible benefits and grants what the Business Finland is providing. But Hanna will tell you more about those. And then moving forward, just a couple of words regarding the logistics. HIMSS has also basically the list of the partner hotels. So the link can be found on their website or behind this link. And like I said, this presentation will be shared with you, so no worry, you will get all the needed links. There's also Hotel Clarion, which is very convenient because they have a very good premises to organize perhaps your own one-to-one B2B meetings at the hotel. So that's here. We know that the HIMSS tickets can be quite expensive. So we actually managed to negotiate additional discount price for us. Because the early bird tickets are already closed, but with this discount, you can actually get 40% discount from the list price. Also, if you are entitled for their startup ticket, which is relatively actually quite cheap compared to normal prices, then you need to be raised. It was 5 million or less funding, or you are very early stage pre-revenue, or you are less than 3 years old company. Then you, in a HIMSS books, you are considered as a startup, and then you are able to purchase the startup ticket. And we also have the codes for that. Then other kind of like logistical matters. Unfortunately, COVID is still with us, but I would say that it's fairly smooth at this point, because basically what is required for the people who are coming outside of EU and the Schengen area is like you would have a full approved COVID-19 certificate, vaccination certificate, or then you have the certificate of having the COVID, or basically you have the EU digital COVID certificate. And good news is also that Finland as a part of the EU, as it was the whole EU and Israel, ratified other countries or each other's basically the vaccination certificates. So for example, when I've been traveling to Finland and I've been vaccinated in Israel, I've been just using the vaccination certificate QR code in Finland, and that works. So that's good news. But of course, please still check the airline requirements separately, because these might still change. I doubt, but it's always good to check. And also there will be a link to the Finnish border patrol, basically the website where they have all the latest travel restrictions. And like I said, EU and Finland have recognized Israeli vaccination certificate QR code. And so if you are basically fully vaccinated here in Israel, you just need to have the certificate with you, and that's it. All right, and let me have a look at the time, as Hanna promised to join us 3:30. And so we were a little bit ahead of our schedule. So maybe this is a good time now to ask perhaps some questions regarding the agenda. Yeah, so if you have any questions regarding the planned agenda, feel free to, you can unmute yourself, or you can use the chat. And also just to highlight one thing, so like Lee mentioned, this whole program is free of charge. So we are doing this as a broader collaboration between Finland and Israel. So the only thing that you would need to buy is always the flight tickets, the HIMSS ticket, and cover your own accommodation cost. But this whole programs, all these lineup meetings and everything, these are for free. And of course, this program is you don't need to be part of every single item on the agenda. Of course, we highly recommend, because with this you are able to get a really good comprehensive overview of the various healthcare districts, data regulations, how to operate in Finland in terms of the secondary use of data and whatnot. So this is a really good deep dive, immersive deep dive. You can cover a lot of ground in 3 days, basically, in conjunction with HIMSS with this agenda. Good. So do we have any questions from the audience while we are waiting Hanna to join us?
Sami, just to clarify one more thing, you said about that Hanna will give some updates about in case Israeli companies would like to open an entity in Finland, vice versa as well. So once we will have the next delegation coming from Helsinki to Tel Aviv, they will get also updates and information by the Israeli authorities about opening an entities in Israel, in order to feature basically this program collaboration. So just to balance it as well. Yay, Hanna, you're with us.
Hey, Hanna.
Hi, everybody.
Hi.
Hi.
And spot on, 3:30.
Yay.
Yes.
Good time.
Very good. So Hanna, we have gone through basically now the background, the reason why we're doing this. We gave an update about the MOU between Business Finland and IIA. We went through the delegation agenda, but I saved all the beautiful things about why the company should come to Finland to you. So with that, you can start by sharing your screen, and the stage is yours.
Yes, thanks. Just jumped from another very intense meeting, so let's hope that my head is now in the right place. Now let's see. Okay, is it full screen for you as well?
Yes, all good.
Great. Okay, yeah, pleased to meet you all. I'm Hanna Lankinen. I work as the head of industry for the health sector at the Invest In unit of Business Finland, and happy to be with you today. Business Finland, shortly, we are the governmental organization that is promoting exports from Finland to global markets, helping international companies to find business opportunities and set up business here in Finland. We also have tourism and talent promotion activities under the same roof. And last but definitely not least, we are the innovation funding agency. So we give out a substantial amount of grants to companies for primarily research and development projects in Finland. And this innovation funding is also available for internationally owned companies, but you need to set up a legal entity in Finland, and then you can be applying for that funding as well. Yes, now Sami told me that you have already talked about the MOU. I just wanted to highlight it from my part as well, because we are super happy to have this in place now and signed and agreed. And why is this an important MOU, and why should you be talking to us and come and visit us next week in Finland? Well, I think that Finland and Israel actually has a lot in common. We have much that we could learn and develop together, and I think much of this is dependent on that. When we look at I visited Tel Aviv a few weeks ago, and actually first time in Israel for me, and I was actually struck by how many similarities there are between the two our countries, except that you have definitely much more sun and beach. We do have a lot of beach. Maybe it's just slightly cooler here at the moment, but what we do have is that we are both always topping the rankings of innovation and research. So we are top in the world of most innovative countries, countries that put a lot of emphasis on research and development. We both have very advanced economies, strong startup scenes backed by government and also private parts. The workforce, in many ways, very, very similar. A lot of scientists and engineers, people good with tech and problem-solving skills. And these are, I mean, this is what you need today. And but we both struggles as well with the same challenge, that we are, in a way, from a global perspective, quite small markets with well, you have almost double the amount of inhabitants in Israel. Finland has only 5.5, but still we need to get more people to work to develop our solutions for global markets. And here I see a good opportunity for us to put our heads together and co-develop things. And this is one of the background ideas of why we are doing this. And we have a really good, I think, matching focus sector. So now for health, for example, health and ICT and everything with tech, that's the areas that are of interest for both, and there we can find a lot of good talent and ecosystems in both markets that needs to just meet. But so why Finland? What is it that makes Finland special? A few words about Finland as a business environment. If you're not acquainted with Finland yet, hopefully you would be after next week coming here, then you will also see how it works in practice. Finland, as mentioned, it's we have 5.5 million people, but we have a country that's actually very large, so we have a lot of space for each and everyone. But with the small population, what kind of builds up the whole well, the society as a whole, and as also the business environment, is that we are all very well connected. It's like a way in a country club where everybody knows everybody. So it's an easy country to get into. And now when you know people like Lee and Sami and me, we can connect you to more or less whomever you need to be connected with in order to make your business run here in Finland. We have been chosen as the most stable country for 14 years in a row. So also there is no big surprises when you come to do Finland. Everything is very transparent, clear. All the information is available in English, and there is never any big unwanted surprises from legislative side or so forth. What you see is what you get in Finland, and you will know the people that can help you, and you can trust people here. Then diving in, especially with the health scene, That's of course, just a second, I will put this so I can, no, sorry. Because now I can see half of my screen. I will just see my own face, but I think I know what's behind the camera. So a few things that make Finland a good place for research and development work in the health field. Well, I would say that firstly, it's all about the talent, and we have an excellent talent pool in health. We have a lot of high-level research in the field. We also have many people that work with like cross industry. So we have people that are very good at have ICT skills, AI skills, skills from wearables, and that can actually apply also to the health side. So this is a good a place to do also broader research and development. The data, I will mention a little bit more about that. That makes Finland super unique, and everybody knows that if you want to do some kind of research in the health field, you need to have access to good health data. And that is something that Finland definitely can provide. And also, as mentioned, we have good, reliable partners in test beds, which you would learn very much about if you come here to Finland, and you will get connected to them personally. Then, as mentioned, just to highlight a few topics, what we are especially good at, if you look at from the medical side, neurosciences, oncology, metabolic processes are themes that have been very deeply researched here in Finland, where we have good research groups and ecosystems that you can tap into. Another field that I think is very, very interesting, could be for you hopefully as well, is medtech. We have the legacy of developing mobile phones in Finland for decades now, and many of these solutions that has been developed into a mobile phone can now also be used for everyday solutions in health and well-being. So, for example, wearables. If you're familiar with the Oura ring, health ring that's developed in Finland, we are very good at imaging, or wireless technologies, and remote solutions for healthcare is also a very big theme in Finland. Also, as mentioned also earlier, AI, robotics, these are topics that we consider ourselves quite advanced at, and where we could make you find good partners in Finland to co-develop with. The data, as mentioned, this is of course this is a really, really wide topic, and I just have 30 seconds to go through it. But if anybody is interested in the health ecosystem, next week, for example, there will be one session on at HIMSS. There will probably be several ones, but really digging deeper into it, and then we would have, as Sami might have already showed, that we would have a special session with all the people who knows this field very, very well. But just in short, as a pitch, showing what makes it extraordinary is that we have all health data of all Finnish citizens from before birth to the day they die in digital format, and so it's longitudinal. You will find not only the health data, it's also the social data, everything, bio samples, tissue samples, whatever, all is connected with. We have a personal code per person, so you can actually gather a lot of information when you want to study something in Finland, and it's. The second thing is, which makes it exceptional in Finland, is that we have legislations that makes it possible to access this kind of information, and people are in Finland very research friendly, so we haven't had any problems in getting people to permit grants for using their data and their samples for medical research. And here as mentioned earlier, we're a small country. It's easy to get connected. We have a one-stop shop for getting, finding the information that you need. We can set you up next week already with the people that can tell you, if we have the data that you're interested in and how the data looks like, what's the number of samples and so forth. So it makes it easy and easily accessible. So please, if this is of any interest, I highly recommend to take a further look at this. Yeah, this I already mentioned. Yes, talent, as mentioned, that we have already been highlighting a few times. We have scientists, everything ranging from production people to highly trained scientists. We put a lot of governmental money into research and development as well, and we put a lot of money into educating people. So there's free of charge education for everyone up to university degrees, which this makes it then easier to have to access people all the time. We get more people educated into doing R&D. Then, of course, the next question, one of the first questions which I usually get from our customers is that, is it super expensive to hire people in Finland? Finland is associated usually with a high-cost country, and I would say that definitely we have been able to keep salaries at the kind, and we want to keep in Finland salaries at that level that it makes sense for also international companies to invest here. So here is a summary of different countries, and if you would have a healthcare R&D center in Finland, actually Japan is slightly cheaper than Finland, but US, for example, already is much more expensive, and also our Nordic peers are, which of course have a similar structure than we have. So now I don't know exactly where Israel is on the list, but I'm sure that you know where to position yourselves, for example, looking at US. We usually show this to show that there is already international companies active in Finland that have chosen Finland and that keep on investing into Finland and employing people here, trusting the talent and the business environment. So, for example, GE Healthcare has their R&D center for their global R&D center for wearable technologies in Finland. Bayer just last year came out with the big news that they are going to invest more than 250 million euros into a pharma-related production and R&D site in Turku. So and we got another similar investment published for a few weeks ago by Finvector. So there is a lot of international companies that choose Finland and are very happy with Finland. So of course we would love to see more international companies here doing stuff, and of course finding the partnerships, and maybe seeing also definitely more Finnish companies finding their business partners in Israel and for developing their activities there. So just to sum this up, so we have time for questions and answers as well. The investing unit, which I represent, so we help you international companies to safely and soundly land here in Finland, and before maybe taking any bigger decisions, also to find you all the kind of information that you need in order to make your decisions about if Finland is the right choice for you. We set you up with partners. If you want to find people on the government side or different cities, look at location alternatives, finding funding options for business. Whatever questions you have, we will try to answer them. And if we can't answer them directly, then we will find somebody in Finland that can. So I hope that you will feel that you will be in good hands from the governmental side when you start exploring your possibilities here. I believe that was it. Yeah, thanks.
Okay. Very good. Thank you so much, Hanna. Let me take over the screen again, and hopefully you can stay with us for 10-ish minutes, so then we can
Yes, now I have run through a series of meetings, but this is the last one. So
excellent, great.
All yours.
Good. And before we open the stage for the questions, then one important thing to highlight is regarding the next steps, because as you all know, the HIMSS is actually taking place next week, and as Lee mentioned, we still have a couple of slots. So we do have this sign up form, and again, this will be sent for all of you, where we are asking a little bit more information about you. You know, what are your main objectives? Who are the key stakeholders that you would like to meet then on next week in Helsinki too? So this is really kind of like helping us to understand better your needs, so that then we can finalize the program and basically make sure that then you have a very, very impactful and meaningful trip to Finland next week. Good. Now let's switch the tables around, and if you guys have any questions, you can either unmute yourself and just ask the question, or then you can post the question on the chat. And if you do it on the chat, kindly then indicate to whom your question is for.
We won the championship in hockey. I don't know why wasn't it mentioned anywhere. Sami. Okay, now we can go back. It's like, oh, what? Okay. Oh, we did a lot of effort in here. Yes.
Yeah, hi, this is Pini speaking from Cardiac.
Hey, Pini.
Hi, Pini.
Hi, how are you? Sorry, I was a few minutes late, and you may have mentioned this topic, but can you elaborate on the topic that exhibition will focus on, and would digital health be one of the prominent issues?
I think, Pini, I think that the line is being cut off a bit. Can you please repeat the question? I think that
I'm asking about digital health technology and how this issue will be promoted in this delegation exhibition.
Do you want to answer, Sami?
Yeah, I'm just like want to make sure that if I understood the question correctly. So how the digital health issue will be highlighted during the delegation?
How it will be covered?
Yes, so, if it will be, if you're considering as an issue that will be interesting from the Finland side.
Yes. So first of all, yes, it is very important. It is very interesting for Finland, and of course we will cover that. I would probably say in most of these areas that we are covering through our agenda next week. And so first of all, everything around the data, the Helsinki HealthTech and Data Networking event is heavily focusing on the digital health side, because we help you to understand, like I said, the secondary use of social and healthcare data, which is managed by FinData at the moment. FinGenius and FinBB are covering then the genomics and biobanks data. Clever Health Network, they have a lot of mainly digital health project and partnerships. And then, of course, I need to leave kind of like what is the emphasis for the digital health in Oulu Health, Tampere Health, Turku Health, and Kuopio Health. I need to leave that to them, but I would say probably it's the emphasis is quite high, because as we heard earlier today, Finland is a huge country. We have it's a very scarcely populated, so all the remote solutions in aging health. Finland is also the second oldest nation in the world. We come second after Japan. So if you have any solutions that are focusing on age tech or helping aging population, are very highly welcomed in Finland. So these are kind of like, I would say, the structural factors why I would say the digital health will be covered quite heavily through the different meetings and discussions and presentations on next week. I know that it's a very broad answer, but hopefully that help. Maybe Hanna, if you wanna add something from your side on that.
I don't think I can add anything valuable. I think you covered it very nicely, Sami. But yes, it's kind of one of the main themes throughout this whole next week, I would say.
Yeah.
Thank you.
I think it's even if I'm looking at the agenda, Sami, it's the majority of the agenda is basically focusing on a digital health, because Finland is a very digitalized country. Based on that, basically, we are trying to refer or to give more opportunities to Israeli companies based on the strength of the local market. So you will be able to access and you have a ROI, which is as close as possible to create a deal flow or clinical trials. So I think that the main focus, without even us requiring or requesting for that, it's the digital health covered in here. So hoping that it answers your question to me.
Yeah, and maybe to add on also, because I realized we didn't talk about that. So Finland has basically 100% of the patient records are digitalized. Our healthcare system is, I would say, probably like one of the most digitalized in the world. Might be even in more digitalized than healthcare in Israel in some aspects. So kind of like the fundamentals are there, and you cannot really avoid operating in healthcare sector in Finland without being somewhat involved in the digital health. Of course, it's a big topic, it's a broad topic, but most of the solutions these days are AI, machine learning, data-driven solutions. So hence it's kind of like one of the cornerstones of the healthcare.
Thanks.
Good.
Thank you, Penny, for your question. Any other questions from the audience?
No.
Maybe if there is no other question, I'll ask one more question regarding the call of proposal for the Israeli and Finland. It will be based on what? On clinical trials or cooperation between Israeli company and Finland company? What would be the base for this call of proposal?
So I can take that one, Sami, for replying. So basically, the Israel Innovation Authority and Business Finland signed a broad collaboration, which means that it will cover many areas for collaboration. It will be included for, of course, clinical trials, test beds, accelerators, collaborations, and many others. The only thing is that Israeli companies, as Israeli entities, needs to stand with the regulation of the Israel Innovation Authority. And this one will be published very soon, and each company will be able to see exactly the preconditions for all possible submissions. The only thing is that you have a quite short timetable for submission. Then it means that the work needs to be done even before or prior to the call for proposals, because you have a very short time slot to work on an MOU or at least a principal collaboration certificate that you will need to add it to the submission. Otherwise, it's a precondition, so you will not be able to get it. But it's a broad collaboration. That's what it's been agreed. It's the whole life sciences and digital health. So it means that it's covered quite a lot of areas. That's it. I'm quite, I'm assuming or quite sure that it will be published in the next few weeks, and then each company will be able to see exactly what are the preconditions and then check if they're standing with the same regulations.
And maybe also just to add and clarify, so the MOU between Business Finland and IIA is more kind of like provide that supportive framework. But then, and one of the key purposes of this trip for the Israeli companies is to really meet these hospital representatives all over the Finland understand what kind of validation, testbed, and pilot clinical trial opportunities they might have, what kind of solutions they're looking for, what is their kind of like the world-class areas where they want to collaborate, for example, with the Israeli companies. And then you need to have that dialogue and understanding and with the hospital. So then the contracts will be signed between the Israeli company and then the Finnish hospital or testbed provider, that letter of intent or MOU, which will be then submitted for the IIA in order to get the grants from the IIAs. But this dialogue and negotiations between the Israeli company and Finnish hospital, we understand that will take time, because you need to understand what do you want to test and pilot or validate, what are the sample sizes, how you're going to do it, what are the costs. So all of these will take time, and the sooner this dialogue starts, the better it is, because then that gives you more time to prepare to your application for the IIA properly. And like I said, IIA will launch the call for proposal with all the details. Then there is probably 4 to 5 months time to leave your submission. But like what Lee highlighted earlier, like now in a conjunction with the HIMSS, because everybody is in Helsinki, we have lined up all the meetings with these different hospital districts and representatives. So it's a very convenient, cost-efficient to start that dialogue and start understanding what are they looking for, what is needed, what are they looking for, and so on to kickstart those conversations.
Thank you.
I have a question, Eyal, from Concept for Pharmacy in Israel. I believe that we are a little bit too late for this conference, going to this conference, since we haven't prepared ahead of time. However, I'm interested in getting in touch with the companies in Finland that will be able to help us either with the distribution or even additional clinical trials for some of our products. Some of them, we manufacture clinical products for hospitals and clinics, and also veterinary disinfecting products. So what would be the best course of action for us to start the process, at least for the months of, I believe, September or October? We will be better prepared to approach the Finnish companies that will be coming here, or maybe the next trip to Finland.
Yes. So we totally understand, because the delegation will take place already next week. But I just put my email to the chat, so you can send me an email, and then most likely we will bring Hanna into the conversation very soon. But we can start so that you can email me, and then we will take the conversation from there once we understand exactly better what, when, how, where, and
Exactly.
Okay, I appreciate your answer very much. Thank you very much.
Thank you.
Thank you. Thank you, Eyal. Okay, very good. Do we have any other questions from the audience?
I think we are good, Sami.
Okay, good. So very good. So thank you so much for your time. Thanks for dialing in with us today. We will send this deck and then the link to the recording probably tomorrow morning. And meanwhile, if you have any burning questions, anything, you can see our contact details there, and my email address is already in the chat, so you can pick it up from there and send me an email or give me a call directly. But yeah, so with that, we hope to see some of you with us in Helsinki next week. It's going to be really, really interesting and intense week, but really, really fruitful. And like I said, like Eyal mentioned, that if you're keen to collaborate with the different Finnish entities later on, we can definitely support you with that one. But this is just a good time to kick off those conversations with the various hospitals and the testbed providers. So looking forward to seeing you there. And with that, thanks again for dialing in today. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Thanks, Hanna.
Bye.
Thank you.